So welcome everyone. Today is a day of Doctor's Day, birth anniversary of Dr. B.C. Roy, Vidhan Chandra Roy, first Chief Minister of Bengal, and who really cared and who really thought about the healthcare in India that time in before 1940s and after 1965 till his death. So we all are celebrating Doctors' Day today, and to celebrate today's occasion, we have none other than uh, Professor Dr. Milind Nadkar, current head of the department, KEM Hospital, Department of Medicine, and the president of Association of Physicians of India (API). And he is a past editor of the journals which API usually gets out, and as well as the book which is very famous among the MBBS and postgraduates. So we have a very eminent personality with us, Dr. Milind Nadkar. Nadkar sir, if I can ask you, our conversation will be in English and Marathi in between. So if I can ask you, today is a doctor's day, anything special for you or it's a routine day for you?
Actually, it's special and routine both. Routine because your routine work has to go on, your ward rounds and your other things do go on. But apart from that, as a Doctor's Day celebration, it's not just about wishing each other, but it's more about caring for the community. And our API, through our association, we always have some programs that are there which are launched all over India, and I'll be part of those in the evening. So we'll be doing some sort of health camps and all that, those things that will be held in the evening. But I always look at 1st July, as a day of commitment. Commitment towards the community, commitment for the patient care. And in today's scenario, with we struggling with the overall health status in the country, because we have got old diseases as well as new diseases, it becomes a bigger responsibility as a physician. On one hand, you are tackling with the infections which are age old. On the other side, you are talking of diabetes epidemic and obesity, diabeticity as we call it today, and the ischemic heart disease. So we are having multitude of problems as compared to any other Western country.
So for Doctor's Day, when you think about it, and imagine around a scenario around 50 years back, when as a schoolboy you attended Parel Vidyalaya in Mumbai Parel. You ever thought of becoming doctor in school days, or it was just a flow of education?
No, I think I never, there's no ambition of becoming doctor.
Dreams? Have you dreamt it?
No, I had dreamt of becoming CA, to be
CA.
very honest. But somehow or other, it was my grandmother's wish, who happened to be a staff nurse only in a municipal corporation. And she saw that probably amongst all her grandchildren, probably I was the best bet, probably to go into medicine.
They all pushed you.
She pushed me, and I think because out of love for her, I decided to come for medicine.
Parle Tilak and Parle College, that vibrant atmosphere. Do you think it is same atmosphere as you entered the medical college, or the schooling was completely different and medical college education was little different?
Of course, schooling was different.
Parle is
because
more of a
Parle
fun.
Tilak Vidyalaya, I remember that time used to be one of the topmost school in Mumbai, and we had such a cutthroat competition in that class of 50.
Yeah.
For you, even if you get half a mark less in unit test, you would feel so depressed, which was not there after you come over here, because you realize that this is totally.
We have etiquettes.
Yes.
So even if
not
you get
etiquettes exactly, but like I mean,
you have more things to follow.
There are more things to enjoy also, whatever later on.
So from your college days to your MBBS journey, I think you joined your MBBS in 1979 in Nair Medical College, that is TNMC, Topiwala National Medical College, and BYL Nair Institute. So how was your experience as an MBBS student as compared to today's, when you think that you are a doctor, full-blown professor, president of Association of Physicians of India, representing 30,000 doctors across the globe, and vis-a-vis a MBBS student who is entering the stairs of TNMC Medical College? So
I
journey.
think that times change, and I think times change every 5 years or 10 years, so to say, whatever. If you say today's generation, and when I entered medical college almost about 45, 46 years back, and if you had asked somebody else who had entered medical college another 45 years back in 1930s, he would have said that yes,
But
it's totally
you have
different.
reached a pinnacle of
So,
a physician's life,
yeah.
becoming president of API and then becoming the academic dean and head of department at KEM Hospital. Probably very few in this physician world did this kind of.
I consider myself extremely lucky.
Lucky.
Like I was very fortunate that I got such openings at right time, and I just continued. But one thing which I will definitely like to insist is that to get into teaching profession is very important for me. My entire career, whether you talk of patient care, you talk of teaching, you talk of my career in API. I think the most important for me is my teaching career, and this teaching career, the whole inspiration is from my various teachers in school. That their dedication of those 10 teachers, and of course, when I was doing MD, it was great to have my teachers like late Dr. Vivishan Bhag, then today's topmost rheumatologist of the country, Dr. V.R. Joshi. My own PG guide, late Dr. J.V. Dungat sir, who just passed very recently, about
So
6
these
months
are
back.
top-notch physicians.
These are very top-notch physicians and very dedicated and very great teachers whom you felt somewhere to imitate them. That you wanted to be like
You
them as a
always
teacher.
wanted to go in those big shoes of those teachers.
Yeah. Those shoes are too big for me.
No, but you had an ambition of to be a good physician once you joined your MD degree. That okay, I want to excel in this field.
Yeah, of course. I think once you choose your own line, after finishing MBBS, you always choose something which you like.
Yeah.
And I always felt that it's just personality also. I always felt that my personality was meant to be a physician rather than an aggressive
surgeon.
Orthopedic surgeon like you.
No, we are a very loving people. We love each other. I believe in love all.
I'm joking.
So your journey as an associate professor and assistant professor in TN Medical College, and your I think 12 or 15 years tenure in that institute. Do you remember any distinct incidences where you thought that, oh, why I became a doctor?
I don't think ever
You
in my
never
life
repented and decided,
regretted till now of being a doctor, and that too never regretted being a full-time teacher. I never ever regretted.
It's a passionate job. Everybody cannot
people
love it.
talk about money, this, that, but I don't think
It's a
it
passion.
ever occurred to my mind that I lost on something because I'm not in practice or something. I'm very contented today. And as you said, once you get into a top notch like HOD of medicine at KEM Hospital,
big
even
position.
did academic dean at such a prestigious institute, I don't think there's anything bigger than God can give you.
So in 2003, Professor Nadkar came to this STM Institute 2006 as a professor in medicine, and later on 2018 he became the HOD. So now sir is almost 20 years in KEM and Department of Medicine. Where do you see the Department of Medicine after 20 years of service in KEM?
I think always the things evolve. New things come, the old things, you try to modify them. Never, that's the rule of nature, the change. And everything has to change. Yesterday's people were different. Their attitudes were different. Today's people are different. They have got some different ideas. So it's actually not good to compare one with other. I think everybody is committed in the department. There is a unity, and we always strive for something good and better for the department. Whether we succeed or not is a different thing, but that will to do something different is always there.
So medicine is a huge field, starting from head to toe, and all the physical systems of the body. So which one is your first love? Because unless you love and you're passionate, you cannot do it. I know the cardiology is separate, the urology is separate, is completely out, nephrology is separate, and maybe
I think I should say that I was very fortunate that within I think 3-4 years of becoming lecturer, somewhere around in 1991, I entered into field of rheumatology.
oh, that is Dr. V.R. Joshi's influence.
Yes, yeah. And I think that really totally changed my career and my outlook towards medicine. In the sense that I found that I got something which was something to look forward. Today also, honestly, I'm telling you that I just look forward to Saturday because Saturday is rheumatology OPD.
Yeah.
And I think that suffices to tell
Oh,
like
in
after
fact,
so many
in
years.
fact, let me tell you that whole KEM know the Saturday is a rheumatology OPD, and we have to send patient to Dr. Milind Nadkar. It is only on Saturday morning, because that is one time they see a lot of rheumatology patient, and his dedication towards the field of rheumatology is very well known. In fact, I spoke to many of my colleagues in private, and some of them said that he is one of the best rheumatologists in the country, so we always refer in the cases. Sir, the progress of Department of Medicine in KEM, somewhere your vision, you think, if you would have been the HOD way back in around 20 years back, you could have changed the system. Anything you think that if you were in power, you could have changed that?
I feel that it would be injustice to my previous
Previous.
HODs if I
No,
say
it's,
like that.
it's just a thought process.
Yeah, it is.
Thought process, vision.
It's everybody's vision, and everybody tries to do something, which they want, they like. And as I said, whether you succeed or not, and at the same time, whatever you are doing, the person across perceives it as a good or bad.
Yeah.
Is a different thing. So you have to be contented, and you have to feel that yes, what I am doing is the best that I could do, and I've given my 100%, and I think that's good for me. I am not trying to compare any HODs or what work they have done and all those things, but yes, if you teach and if you see your patients, I think it's more than adequate.
Apart from being a very good teacher, Professor Nadkar was actively involved in COVID management, the pandemic management. We started in 2020 as a Wuhan virus. Any experience of that time you would like to share with our viewers, like what exactly went wrong and how the things got controlled? Probably you are a part of that team also, the state government team, which...
I was not initially, but yes, later on. I'll tell you one thing that see, there will be always some sort of fallacies and mistakes that people will pick on your management. Nobody can be perfect in such a pandemic situation which nobody has seen in our lifetime. Right. So there is no question that we have done like this, and
there is no experience to anyone.
There's no experience, and I still feel that I'm not talking only of KEM. I feel that whatever the municipal corporation of BMC has done for the management of COVID is excellent. I think the best in the country was in fact I should say that we were lucky that we were in Mumbai when we had this pandemic, because otherwise I don't know what would have. I'm not trying to criticize anyone, but what I'm trying to say, the best was with us.
BMC has done wonderful.
And I'm very happy that I was part of it, and of course in KEM, as you said, I was more into the logistic managements and all, because
that is very important,
because of age factor and whatever.
Leaders don't go on the ground, but ultimately the leaders' choices and decisions make a lot of impact. And probably I have seen it very closely, because I saw AMC, Dr. Kakani, Mr. Kakani, the director then, and our dean, and you used to have a lot of VCs and video conferencing and lot of decision making.
3, 4
So I think pandemic has made us learn a very big lesson how to manage the next pandemic.
Yes.
Probably we don't have to face it. That's the only thing we can pray on Doctors' Day. So talking about Doctors' Day special, basically today we are going to discuss about the current health facilities in city of Mumbai and our country per se, because we see a lot of brain drain. People graduate from here, the MBBS, the MD, they go to US, UK, they never come back. So in this situation, how do you find the healthcare issues in Mumbai, city of Mumbai, which caters almost 30 million population, and our country is 1.5 billion population. So how do you see these healthcare facilities being upgraded?
See, first of all, we have to consider that we are a developing
Developing.
and uh, if it was in your hands, you would allocate maximum funds.
We make you a chief minister and
Okay.
health minister for a day.
Yeah.
So, or maybe a day or maybe a month. What will be your viewpoint and your vision to improve the healthcare for well-being for others?
It's basically the allocation of funds for the health
Funds,
sector.
yeah.
But we have got resource crunch. We have to have development all over.
All over.
I mean, we have to spend on defense and all those things, whatever. But so much of money goes over there. But that's a part, you know. If we don't survive, then what is the use of just spending all this? So you have to strike a balance. And in whatever resources are available, you have to manage.
I think
you cannot keep on grumbling that the government gives us less.
No, but there is a big drastic change which has happened in last 10-15 years in developed country and developing country as well. Amongst the indices, the healthcare expenditure budget in India has drastically reduced as compared to the other countries which are increasing their healthcare budget. So I think that's an alarming signal. I think this conversation reaches right here, and they understand that healthcare needs additional budget. If we survive, healthcare is like an internal defense. If we survive, then only we can have a defense system. I know we are surrounded by a lot of enemies and we need a good defense system. But similarly, we need a very good internal defense for the healthcare. Otherwise, we are not going to come up with the idea. So then comes the health for all. That is the World Health Organization. We see a lot of famine, the diseases, the pandemics in Africa, certain diseases in North Korea, South Korea. So India being an endemic country, part of sub-Asian country. So we are always at the verge of getting this infection merely because of our population. Second, poverty. So where do you find this sustainable development goal of WHO and United Health for All? So you think these goals getting the right direction in India, or we are somewhere losing the track? I want frank opinion.
I'll tell you one thing that as far as the governments are concerned, I think they are trying to find a proper path. I will not criticize just for the sake of it. It's always that because of the resource limit that we will not get the results that are expected. On top of that, simple our social habits are also a big barrier to getting healthcare, and even if it is available, our own habits kill ourselves. For example, simple spitting on the roads. Simple. Whatever. I think once till we don't correct ourselves, we don't keep our environment, good and clean. Like Prime Minister when he launched Clean India and all those things, Swachh Bharat Abhiyan and all. I think everybody has to.
It's a moral duty of everyone.
It's a moral duty of everyone because these are the simple indicators which are things that are going to change our health indicators in a big way. So unless you yourself are committed to that, there is no point in blaming anyone.
There has to be a movement from the society itself.
Yes.
Yes, we want something change.
Yes.
Because I've seen the poorest of poor country like Cambodia, Vietnam, Indonesia, even Philippines. They are much cleaner and neater than us. They are poor. Their GDP is not as high as us, but still they are much cleaner. Probably that is the reason they don't have the health issues like what we face in India.
Maybe over a period of time, let's hope that people will this thing that nowadays, because environment is a subject that is being taught to school children. I think they are becoming little more and more aware. I hope it will change. This change is going to be gradual, but I'm sure it will come.
So, looking at the current issues, and you are a part of associations of physicians of India, you must have had a lot of discussions on current health issues of India and how to upgrade it or how to get in fact. Do API gives the guidelines or suggestions to the government of India officially that okay, this is like Like the Association of Physicians of USA, they have their channels open.
Yes.
So do we have those channels for API open with government or ministry to communicate on certain disease like diabetes? We should do this. For blood pressure, we should do this. For TB, malaria, we should do this. So do we have those channels open between the Doctors Association and the ruling government?
As far as this, interaction between the medical fraternity and the government is concerned, I think the lead is taken by Indian Medical Association, IMA. However, nowadays, last 4-5 years, maybe 7-8 years, that API we have taken some leads. Whenever there is anything that is health issue, we try to communicate. We try to have some meetings with them and try to at least convey our things. And at the same time, as our association, we are even putting out our own guidelines for the physicians.
API guidelines.
Like we have got API guidelines for management of diabetes, API guidelines for management of hypertension, API guidelines for management of ischemic heart disease. So all these guidelines are there.
Yeah.
So, and we usually form these guidelines in collaboration with the specialty organizations of those diseases also, so that they are also with
Part
us
of it.
and this thing. But because the physician community
But
is
this
very
is as
big,
far as the common diseases are concerned.
Yes.
When you're facing uncommon disease like rare diseases, so do we have some guidelines to the government? Okay, that this is a category of rare disease and this needs a special attention.
Honestly, not really. But
Not really.
but whenever any new disease comes, like you're talking that I was editor of JAPI for in between for almost 7 years, and during that time there were suddenly Crimean Congo fever came, some West Nile fever came, some
Japanese
that time
encephalitis.
H1N1 came during that time. So every time then through JAPI we used to have articles, we used to have editorials. In fact, I'm very proud to say that when COVID was there, during that time, for consecutive 18 months in JAPI, every month the editorial was on COVID and some other aspect of it. So we just covered so that entire community, at least physician community, is aware of this. Plus, we published a lot of articles related to COVID.
So another aspect of his life is one of the very good writer, and he writes a lot of papers, publications. He's a part of JAPI for quite a long time, I think 7-8 years, and he's also a part of API. So that was a personality in KEM Hospital which never talked upon. There are many people who speak a lot, but the gentleman who doesn't speak doesn't mean he is quiet. He is a very intelligent person, and probably is the right choice to be head of the Department of Medicine and lead the KEM Hospital from the front. Thank you very much for this episode. We'll come back again with a new episode.
Thank you.